population exploding, your healthcare options changing. KXAN presents Atxpansion. Get in-depth coverage about a growing health crunch. It's interactive, it's hyper-local, and you get to ask the questions.
Good evening, everyone, and welcome to this KXAN News special, Atxpansion. Tonight, a town hall presentation where we're focusing on health care here in Central Texas. I'm Leslie Rohde.
I'm Robert Hadlock. Health care, of course, a daunting topic for all of us because it touches every one of us in very individual ways, of course. Tonight, our goal is just to start the conversation about how best to improve medical care as our Central Texas population increases.
And before we introduce our panel of guests up here tonight, our Doug Shoup shows us now some of the things that we will probably be talking about this evening.
When it comes to health care, there's a lot to talk about, from the push for a medical school and teaching hospital to replace UMC Brackenridge.
Having a medical school here will enable us to provide more support personnel, more doctors.
People will no longer have to go to Houston or Dallas.
To the increase in freestanding emergency rooms to treat patients in suburban areas.
We can do lab studies, we can do CAT scans, we can do x-rays. We have basically everything we need to make diagnosis and to stabilize patients and to give patients what they need in one location.
Actually, they took me in right away. They took care of me right away. The staff was wonderful. Under your tongue.
As Central Texas's population grows, there's also a need to address indigent care and access to medical facilities for those in rural communities.
We anticipate that the need for access is just going to continue to grow as these rural areas become more populous.
It's important because, you know, your life depends on it.
And although there are challenges that we face, there are also healthcare successes to celebrate.
So as a surgeon, it's like you're sitting inside the patient and everything is miniaturized. So that allows you to get into very difficult places, the ability to control and see things that you weren't able to do before.
Despite all the advances, there is also a growing need for us to all take better care of ourselves to prevent serious illness. That includes eating better, knowing our cholesterol, blood sugar, and blood pressure levels, as well as exercising more.
If you don't keep your kids active and you don't give them a proper diet and you keep them inside, I guess, you know, diabetes is something that could always happen.
Healthcare means something different for everyone, but it's something we all need, and having access to it is something we all should have. Doug Shoup, KXAN News.
We are live in Cedar Park, where the Hill Country Bible Church has graciously allowed us to use their beautiful facilities tonight.
And we want to introduce you now to our panel of guests on the stage, beginning at the far end of the stage. Patricia Young-Brown, President and CEO of Central Health, the state agency covering health care needs in Travis County. Dr. David Huffstutler, President and CEO of St. David's Healthcare. Jesus Garza, President and Interim CEO of Seton Family of Hospitals. Dr. Nancy Dickey, President of Texas A&M Health Science Center. Dr. Russ Krinke, Medical Director for Austin Regional Clinic, and Lou Little, CEO of Hardin Healthcare, providing services for seniors, including home health, hospice care, and rehab.
And audience members have submitted questions for our healthcare pros with us this evening, as well as a panel of experts sitting here on the front row. All of you watching this broadcast can also participate anytime you'd like through a live chat we have underway right now at KXAN.com, also through Facebook and Twitter.
All right, let's get the ball rolling. We know we have a growing population, so let's just throw the ball out there and say, what are some of the biggest challenges you all think we are going to face in the coming years as our population continues to grow as far as healthcare is concerned? You want to begin, Lou?
Sure, Leslie, I'd be happy to. You know, you think about, from a senior perspective, 10,000 people turn 65 every day. With that, there'll be 55 million people 65 years or older as of 2020. In Texas, that number is 10%. Medicare and Medicaid just don't have the capacity to take care of this silver tsunami that's occurring. So it's a great worry. When you add on top of that the shortages that you see, primary care physicians and nurses, it represents a difficult dilemma.
Who else?
Well, in fact, let me just tag on to the end of that it's not just nurses and physicians, but actually we have shortages in all healthcare professions, pharmacists and dentists and dental hygienists, and we have here in Texas started this tsunami, if you will, with shortages in all of those areas compared to other parts of the country. So when the rest of the country says we're looking at a time of shortage, we have to understand we need to catch up and then deal with the shortage, and our population is growing as fast as any state in the country.
And as that population grows, that's a great thing for our area, but as it grows, we also have a lot of people who don't have access to health care funding. They have access to health care services. Those people can come to our emergency rooms and receive care, but so many of them, 28% or so in Central Texas, are uninsured, about 25+% in our state. They don't have access to health care funding. All of those of us with employer-based health insurance pay for that. That's causing the cost of health care to increase. Trish and her folks at Central Health do a great job to alleviate some of that, but it's a real issue in our community.
What I would say, that I'm having trouble with my microphone. What I'd say is what compounds that problem is the way health care gets delivered. It's done on an episodic basis. It's not coordinated very well. How it gets handed off from one provider to another is not done very well. And that drives up the cost of care. The delivery sometimes isn't what it ought to be. The cost is certainly not what it ought to be, and those are challenges that we have given the number of people that are going to be eligible for Medicare on into the future.
We're going to be hearing a lot about money woes tonight, no doubt about that. Brian Sanders.